Hi guys. So today in cardiology series we will discuss AF. Yesterday night I had a party and the party was literally AF. Today's lecture topic is also AF and I hope this lecture is going to be literally AF. AF not that AF. Today we will discuss AF, that is atrial fibrillation and atrial flutter. However, party and AF are very closely related. If someone takes up lot of alcohol, caffeine or cocaine in a party, it can literally precipitate AF. AF, that is atrial fibrillation. So in today's lecture we will discuss atrial fibrillation and atrial flutter. So no more nonsense. Now let's discuss AF. Atrial rate is approximately 350 to 500 or say 600 per minute. Now these impulses has to pass via AV node, but AV node will block few of them and final output will be 100 to 200 beats per minute. And this is your heart rate and this is your ventricular rate. Important point over here is that these heart rates, these ventricular contractions will be irregularly irregular and therefore there will be variable RR intervals. So this is irregular pulse. In this particular ECG, you can appreciate that RR intervals are not equal. This RR interval is very long. This RR interval is short. Again, this is long. Again, this is extra long, then short. So in this case, RR intervals are not equal. And this will represent irregular heart rate. And this is hallmark of atrial fibrillation. Plus, you can also appreciate there is no P wave, and these P waves are replaced by very insignificant waves known as small f waves or fibrillatory waves. So in this case, QRS complex will be normal. There will be no PR interval because there is no P wave itself, and this is irregularly irregular heart rate or irregularly irregular ventricular rhythm. Right, so let's summarize. So in this case, you can appreciate that QRS complex will be normal. PR interval will become irrelevant because P wave is itself absent. It is replaced with help of fibrillatory waves. Plus, there are unequal RR intervals. Treatment of atrial fibrillation. In case of atrial fibrillation, we have already discussed that you have multiple things to address. For example, you have higher rate and that too irregularly irregular. Therefore, you guys will need rate controlling drugs, particularly beta blockers. You have rhythm abnormality due to ectopic pacemaker firing at a very high rate. Therefore, you also need rhythm controlling drugs, that is antiarrhythmic drugs. Last but not the least, there is increased chance of formation of clot in the left atria or left atrial appendages. Therefore, you also need to give anticoagulants.